my name is Antonina Capello, and I'm a licensed clinical social worker. I'm here today to teach you a little bit about treating PTSD. I'm going to start out with telling you how I'm going to assess someone for PTSD. And secondly, I'm going to introduce two different treatment methods for PTSD, and then I'm going to kind of dive into this specific case, the specific issues that might be surrounding this case that are unique to the client. So for the assessment, I'm going to go ahead and first hear the client's story, and then you're going to kind of see how my wheels are turning a little bit and trying to differentiate between acute stress disorder and post-traumatic stress disorder. And then I'll start asking him a few questions so I can kind of really make sure that we're dealing with PTSD here and not maybe generalized anxiety, depression, or something like that. And then I'm going to come in with kind of a shortened version of some treatments for him. I'm going to kind of outline, I'm going to show you how exposure therapy works and how stress inoculation works, and that's kind of going to deal with the specific issues that are pertaining to this client, whereas the exposure therapy is kind of more geared towards helping him deal with the memories that he's going through as far as his traumatic incident. Then at the end, I'm going to refer him to a psychiatrist, which I think is a good idea. In this particular case, I'm going to have a client reenact, I'm going to have an actor reenact someone who's an actual client that I've had, but this is, obviously for confidentiality, this is not the actual client. But anyways, I'm going to refer this client to a psychiatrist, and that'll pretty much wrap it up as far as the training goes, but this would be a long process. This would be over the course of several sessions until my client starts to feel better and starts minimizing these flashbacks and things like that. Okay, well, I hope you enjoy the example session. So Alan, what brings you into my office today?
My wife has been seeing a therapist, and he recommended that I see someone too. We had an incident happen a few months ago, and it's been difficult for us. So that's why I'm here. My wife Laura, she was raped in our home. I left for work one day, and someone broke into the house and assaulted her. And I got the call from the police at work. I came home, and it's just been difficult for us.
I imagine so. I'm very sorry that happened to you.
Thank you.
That's terrifying for both you and your wife.
Yeah, but it was. It was.
About how long ago did this happen?
It was about 5 months ago. A little more than 5 months ago.
Okay. And what kinds of things have you noticed have changed as far as your demeanor and your feelings and your sleeping and that sort of thing?
Sleeping. I don't sleep very well.
Okay.
I come to bed late. I work late. She and I don't really talk a whole lot,
Okay.
I don't really, I don't know how to talk to her.
Have you kind of been avoiding her a little bit, do you think? Whether intentionally or unintentionally?
I mean, yeah, she says I have. and it's not on purpose.
Sure.
I just feel like there's like a wall. I don't really know how to get over it. I guess.
I can imagine that you see her kind of differently now, almost.
Well, no, I mean, it's not. I guess. I don't really know what to think.
Yeah.
And I don't really know what to say.
Is it kind of, I mean, do you think about what happened that day to her when you do see her?
Yeah.
It reminds you of that. Okay.
Yeah, it does. I think about it a lot. I think about, waking up that morning, it was just a normal day, and I was actually running late for work, so I had to get out of there fast, and I can't help but think, what if I just stayed home?
Okay.
I think about how I was just sitting there, going about my life, doing paperwork, and the next thing, I'll get a call from the police telling me that someone's attacked my wife in our home, and...
Okay. So would you say these are pretty recurrent thoughts?
Yeah.
Okay.
I have these images
Okay.
of it happening.
Yeah, disturbing images.
And I don't, I wasn't there, but I see it. I see it happening.
Day and night?
Mm-hmm.
How about like in your sleep? Like I know you are having some difficulty with some sleeping.
When I finally can get to sleep, I'll have dreams about it sometimes, or the dreams have that feel, that emotional, the feeling with them, even if it's not about the thing, it's still that feeling that is with me most of the time when I'm awake.
Mm-hmm. Okay, so the same feeling of anxiety and fear that you felt, and absolute horror that you felt when you found out about what happened to your wife, you're sort of re-experiencing that in your dreams when you are able to get to sleep.
Yeah.
And then likewise during the day you're thinking about the actual event.
Yeah, I mean, I'm trying not to. It's affected my work.
Sure.
My boss is a great guy. He's been really supportive, but a while back he gave me a bit of a reprimand. I guess I wasn't pulling my weight.
Sure.
And we've just been sort of isolated, the two of us.
Were you able to take a break from work for a couple of days, or at least maybe a week or two after this happened? Or
Yeah, they gave me about a week.
okay.
They said I could take more, but I wanted to get back to the routine, and Laura thought I should get back to the routine. So.
Okay. How about when you do see your wife, or when you go back to the house? How does that feel?
Well, I'm sure if she was here, she'd tell you. A couple of months ago, I tried to move us.
Okay.
I tried to. I guess that was kind of crazy. I tried.
I think that's perfectly understandable.
It's, the house just
It reminds you of it.
like there's this like feeling right here, like a tightness, and it's worse at the house.
Sure.
And
Absolutely.
and I'm trying, I just want to be strong for her, strong and be in control. And
Okay.
when I see her though, I just, it's getting somewhat better. We're kind of getting back to the old routine. but it pops in my mind at least once a day. And
Okay. And then these thoughts and feelings, they've been going on for about 5 months.
Yep.
Right?
mm-hmm.
Okay. Well, that's a long time to have to be feeling this way. I'm glad that you came into my office.
Yeah, I was a little hesitant.
Sure.
It's not what I do.
It's a scary thing.
Yeah, I don't. Well, I don't. I'm not great at talking about feelings.
So far, you're doing really well.
Thank
You're
you.
doing a great job.
Thank you.
This is a really tough thing to have to discuss. Well, from what you've told me, it kind of sounds like, have you ever heard of PTSD?
Is that post-traumatic stress? Yeah. It's like for veterans.
Sure. Uh-huh.
Yeah.
It kind of sounds like that to me. Does that seem kind of the degree? Do you,
I mean, no one's shooting at me.
yeah.
Yeah.
Sure.
I don't know. Maybe.
Yeah.
I mean, I guess it's safe to say it was traumatic for us. So.
Absolutely. Well, what I'd like to do is kind of guide you through what happened that day when you found out.
Okay.
And I also kind of want to talk about what your wife has disclosed to you about how she's feeling, because sometimes we take on others' feelings. So
Okay.
PTSD is common for women who have been sexually assaulted. And I think you could have almost a vicarious PTSD, not only from her, but your own manifestation of the PTSD, just from having to be afraid to leave your wife, and just that intense level of guilt that you might be holding on to from that.
Yeah. I mean, yeah, I do.
Does that seem kind of
That's,
accurate?
sounds right.
Okay, so in future visits, what we're going to do is I'd like to talk to you, and and we'll go at your pace.
Okay.
As soon as you're ready to talk to me about what happened that day and so forth.
Yeah.
We can go ahead and guide you through that. It's a little technique called exposure.
Okay.
And we're going to just lightly expose you to that event. And then, we'll walk through it together. And I will be kind of, we'll do it through imagination, obviously. And I will be able to give you a way to look at it more objectively and kind of take yourself out of that situation and look at it in a way that's not going to be as scary. Okay?
That would be good.
We'll talk about some breathing exercises and some meditation that you can also do on your own in the meantime. And then we'll also be talking about what's going on, what kinds of feelings you're experiencing. I know you're saying you get that feeling when you dream.
Yeah. Which
We'll talk about how we can do some breathing exercises to sort of mitigate those feelings. I would also like to kind of talk to you about how it might be difficult that something happened to your wife like this, and how just our culture has an expectation, a very, very stringent expectation upon men to protect their wives and to be the breadwinner and that sort of thing. And I can imagine your needing to take a break from work may have tapped into some feelings of your masculinity being compromised. Does that seem fair?
Now that you say it, I guess that's possible, yeah.
Sure. I'd also kind of like to talk to you in the future. We can talk about how the relationship between you and your wife.
Okay.
And sometimes our boundaries in relationships can get kind of blurred. Sometimes you can take on her feelings, or she can take on your feelings, and that sort of thing. And it's nobody's fault. It's things that, you know, we've grown up with. We've been raised this way. And so we can kind of, we can look into that too, if that sounds,
Yeah.
that sounds cool.
Yeah, that sounds good.
Alright, great. In the meantime, I know a great psychiatrist in the area who might be able to prescribe you something for right now in the short term, with helping you get some sleep and. Sure, please.
I don't know if I'm like depressed. I don't know if I need a psychiatrist.
Sure.
I'm kind of a little skeptical of that. I don't know if that would help.
Okay. Yeah, and that's
I don't feel
totally
like sad all the time. I don't feel depressed.
You know, and that's totally up to you. I wanted to offer you that option. Should you feel in the future you'd like me to give you some names of some psychiatrists that I've worked with, I'm happy to do that. They might be able to give you something that'll help you in the meantime as we go through this journey of therapy.
Mm-hmm. Okay.
But
that's
completely at your discretion.
Yeah, I mean, I would just like the feeling here, like, to go away. I like my head to feel clearer. So I don't know what that would take, but that's what I want.
Okay. All right. Well, would you like to kind of do a breathing exercise real quick about that feeling right here?
Sure.
I want you to close your eyes. Take a deep breath. Remember you were telling me you felt that feeling in your chest?
Mm-hmm. Kind of feeling it right now.
Yeah, sure. I want you to take a deep breath and breathe into that feeling. Let the air...
What do you mean?
I want you to, when you breathe in, imagine the breath as this healing light going into that feeling in your chest.
Okay.
Okay? And I'll breathe with you. Okay.
Is that right? Is that okay?
That's good. How do you feel?
I feel okay.
Yeah? Okay.
Yeah. So how often should I do that? Try to do that?
I would say anytime and all the time you're feeling a level of discomfort.
Okay.
Just get in touch with that feeling in your body and breathe deeply into it, okay?
Okay.
All right. Well, I'd like to see you next week. And this will end our session today, but thank you for coming in. And I think you did a great job.
Thank you.
And yeah, it was nice to meet you, Alan.
It's nice to meet you. Thank you.